Welcome to the landmark debate session of the 14th Cohort of the Policy Advocacy in Genetics and Genomics course, a flagship training program of the Pan-African PGS Education and Research Initiative, PAPERI. This 14th cohort marks a historic milestone. With participants from across the continent and beyond, this is the largest and most diverse cohort since the course began, a true testament to Africa's rising leadership in genomics and policy advocacy. Through intensive modules, mentorship, teamwork, and deep reflection, our participants are mastering not only genomic concepts, but also the strategic policy thinking required to build ethical, equitable, and future-ready health systems. In part one of this debate series, we proudly spotlight young professionals and emerging scientists from Cameroon, Tunisia, Côte d'Ivoire, Algeria, Nigeria, Ethiopia, Mali, Kenya, South Africa, Zimbabwe, Tanzania, India, and the Democratic Republic of Congo. They bring with them a powerful mosaic of experiences, scientific expertise, cultural insight, and national perspectives. Together, they stand united by a common purpose: to shape Africa's genomic future with courage, clarity, and the highest commitment to public good. Today, these brilliant emerging leaders step forward to engage in bold, evidence-based discussions that confront some of the most urgent questions in genetics and genomics. Their debates are not just academic. They reflect real-world tensions, ethical dilemmas, resource challenges, and policy trade-offs that will shape the direction of genomics across Africa. Prepare to witness powerful exchanges. Insightful, rigorous, and deeply rooted in the lived realities of the continent.
Hello everyone, I am Ifejeson Victoria Deni from Nigeria, and I've selected a topic for the Policy Advocacy course. So my topic is: should African governments invest in creating genomic databases for pediatric cancers, including leukemia, to improve equity in treatment? I'm on the negative team. Please vote for us. Thank you.
Hi again. I'm Dr. Jihan Benay Sahaj from Tunisia. For our upcoming debate with PAPERI, we as the Group 1, my colleague Ernest from Cameroon and I, have chosen Topic 1, treating the question: should African government invest in creating genomic database for pediatric cancer, including leukemia, to improve treatment equity? I'm taking the affirmative side because we believe that building this database is key to ensuring children across Africa receive treatment tailored to their genetic backgrounds. It's about fairness, innovation, and giving every child the best chance to survive. Stay tuned for our debate session. See you there.
Hello, I'm Kwame Ambroise Kentosu from Côte d'Ivoire. I'm a member of Group 2 and part of a team defending the negative side on the topic: should African countries create regional genomic databases to advance research on cancers that disproportionately affect their populations? I look forward to engaging with you in the debate section.
Hello, I'm Caroline Chuku from Nigeria. I'm on the negative side of the debate topic: should African countries create regional genomic databases to advance research in cancer that disproportionately affects their populations? See you on the debate side.
Hi. Stigma harms people's lives across Africa by causing them social exclusion and barriers to economic opportunities and healthcare. That is why I chose the topic: should African nations make genetic counseling services free in order to reduce stigma associated with genetic disorder? I'll be arguing in the negative team with my teammates. My name is Makangarba Chariso from Mali.
Hello. On January 10th, the coming Saturday, we will have a debate and I will be representing the affirmative side of whether African nation should make genetic counseling service free and accessible in order to reduce stigma associated with genetic disorder. So I will debate by affirming that African nations should make genetic counseling service free and accessible. And I will politely ask you to wait for us for this sensational debate. Thank you very much.
Hi, my name is Oyetunde Oluwamuyiwa Joseph. I am from Nigeria. I will be arguing against the debate topic, should African nation make genetic counseling free and accessible? Genetic disorder is a common disorder among millions of people living in Africa, often carrying with it every stigma which can lead to social isolation, emotional distresses, and delayed medical care. But would making genetic counseling free and accessible be the solution? Join me in a lively debate session where we will be exploring the pros and cons of making genetic counseling free and accessible in Africa. Thank you.
Chair, distinguished opponents, esteemed guests, welcome to the PAPERI debate, wherein myself, Amir Gassoum, a research scientist affiliated with the Pasteur Institute of Algeria, alongside my fellow colleague, Dr. Ronald Mahomer, will be arguing the affirmative in regards to the question of should African nations invest in gene therapy as a long-term solution for chronic and genetic diseases. We look forward to welcoming you all to usher in a new discussion and to shed new insight in terms of how Africa can be a leader in this new frontier, and this being the new imperative for the African continent to re-establish and reclaim our scientific sovereignty and be a global player, and to import these technologies and remove this systematic exclusion of the African continent from cutting edge novel technologies. We look forward to meeting you all, and we look forward to entertaining all of your questions. Thank you very much for your support. Thank you very much.
Is Ferrari car of any importance when one cannot afford a pair of shoes? Or better still, should African nations invest in gene therapy as a long-term solution for genetic and chronic diseases? Well, stay put, as I, Mongare Nicholas from Kenya, lead Team Negative in discussing this amazing topic in helping our health systems in Africa prioritize our necessities right. Thank you.
Hello everyone, I am Marlene Fomonyoy, an MS1 student in Biotech at Cameroon. I'm so excited to be part of the Policy Advocacy on Genetics and Genomics course debate. I will be part of the affirmative team, and we will be answering a very important question. Should individuals have full ownership over their genetic data and have the right to monetize it? It will be a very engaging session, and my team and I are already deep into preparation. So please come ready to learn and engage. Thank you very much.
I want to talk on the topic titled, should newborn genomic screening for conditions like sickle cell anemia be mandatory to improve early intervention efforts? I will be the affirmative team. Wait for us. My name is Moses Olayemi Akibinu from Nigeria. Thanks.
As we conclude, we warmly invite you to join us for the live Part 1 debate session on Saturday, January 31st, 2026 at 3 p.m. Cairo time. Be part of an inspiring moment where the next generation of scientific and policy leaders challenges assumptions, proposes solutions, and reimagines the future of health, equity, and genetic innovation. Don't miss this opportunity to celebrate excellence, amplify African voices, and support the young leaders who are shaping tomorrow's genomics landscape. Together, we advance policy. Together, we ignite advocacy. Together, we build a genomics-ready Africa for today and for generations to come. Let's make it happen.